Hey everyone, and welcome to this explainer on abnormal psychology. Today, we're stepping right into the shoes of future healthcare professionals. Imagine we're sitting in a modern classroom, led by an inspiring African lecturer, and we are totally ready to learn. We are going to explore the literal foundations of human psychology, specifically looking at conditions that interrupt everyday life. We're going to see exactly how our thoughts, our emotions, and our behaviors shape our daily realities. It's a fascinating and honestly deeply important topic. So, let's get started.
So what exactly are we talking about when we use the term abnormal psychology? Well, formally, it's defined as the study of mental, emotional, and behavioral disorders that affect a person's daily functioning and overall well-being. But why does this actually matter to you as a focused learner or a future healthcare provider? Because this foundational knowledge is absolutely critical. It's what helps you understand human behavior on a much deeper level, communicate way more effectively, and ultimately provide holistic, empathetic, patient-centered care. You really can't treat the physical body without understanding the mind.
Okay, let's dive into this. Here is our quick roadmap for today. We'll start with the spectrum of anxiety, move into panic and social anxiety, take a look at trauma and compulsions, discuss severe conditions like depression and schizophrenia, and then wrap it all up with treatment and care.
Section 1. The spectrum of anxiety. Understanding the basics.
I really want you to anchor these clinical terms to real human experiences, from the raw emotions someone feels to how the brain is actually firing during these episodes. Anxiety disorders are mental conditions characterized by excessive fear, nervousness, and worry that actively interfere with a person's normal life. Now, this isn't just feeling a little stressed before a big test. We're talking about visceral, physical symptoms: sweating, trembling, a rapid heartbeat, severe restlessness, and an inability to sleep. The body is essentially reacting full force to a threat that isn't actually there.
All right, let's test your knowledge right out of the gate. Which of the following is an anxiety disorder? Is it A, diabetes, B, panic disorder, C, hypertension, or D, asthma? Have you made your choice? The correct answer is B, panic disorder. Awesome job if you got that one. Let's keep building on this.
Let's look at one of the most common forms out there: Generalized Anxiety Disorder, or GAD. Picture a student who's just visibly overwhelmed. They are overthinking their exams, their bills, family drama, and work, all at the exact same time. GAD involves this persistent, excessive worry about everyday situations. It's like a relentless mental loop, and it leads to very real physical exhaustion, muscle tension, and major sleep problems. Imagine trying to focus in class when your brain is sounding a constant, exhausting alarm about literally everything in your life.
Okay, let's see if you caught that last bit. Which symptom is super common in generalized anxiety disorder? Is it A, excessive worry, B, blindness, C, memory loss, or D, paralysis? Luck in your answer, and the answer is A, excessive worry. Spot on.
Section 2. Panic and social anxiety. Dealing with intense fear and judgment.
Let's talk about panic disorder for a minute. Imagine suddenly experiencing a full-blown panic attack in the middle of a crowded area. Panic disorder brings on these sudden, totally unexpected attacks that are characterized by intense, overwhelming fear. And the physical nature of this is honestly terrifying for the patient. We're talking chest pain, heavy sweating, rapid heartbeat, dizziness, and trembling. It frequently mimics the exact physical sensation of a heart attack, which, as you can guess, only fuels the intense fear they're already feeling.
Now, what's really interesting about this next condition is the behavioral impact. Think about social anxiety disorder. You might see a student who is completely paralyzed by the fear of just presenting a project to their classmates. This disorder is defined by an intense fear of social situations and a crushing fear of negative judgment from others. It leads to very specific behaviors: completely avoiding presentations, a fear of speaking up, social isolation, and really low eye contact. It is a debilitating barrier to learning and connecting with people. Let's see if you can diagnose the behavioral vignette we just discussed. A learner refuses to present in class due to a fear of embarrassment. What might this indicate? A, OCD, B, social anxiety disorder, C, PTSD, or D, bipolar disorder. Got your diagnosis ready? The correct answer is B, social anxiety disorder.
Section 3. Trauma and compulsions, specifically OCD and PTSD.
Let's contrast these two conditions because they operate quite differently. OCD involves obsessions, which are highly intrusive thoughts, and compulsions like excessive hand-washing, repeated checking of locks, or counting rituals that the person uses to try and soothe those intrusive thoughts. PTSD, on the other hand, develops after exposure to a severe traumatic event. It leads to terrifying flashbacks, nightmares, hypervigilance, and the total avoidance of absolutely anything that might trigger the memory of that trauma.
Quick check-in. Let's test your understanding of that comparison. Which disorder commonly involves things like compulsive hand-washing? Is it A, PTSD, B, OCD, C, schizophrenia, or D, depression? Make your choice. And the correct answer is B, OCD.
Section 4. Depression and Schizophrenia, exploring severe mood and psychiatric disorders.
Imagine someone feeling so isolated, sitting in a dark room just struggling to find the baseline energy to seek out counseling. Major depressive disorder is a serious mood disorder, and it carries a heavy, draining burden. It causes this persistent, unshakable sadness and a profound loss of interest in things the person used to love doing. The symptoms include crushing feelings of hopelessness, severe fatigue, drastic changes in sleep, poor concentration, and tragically, suicidal thoughts. It literally drains the color and energy entirely out of a patient's life.
Now, schizophrenia is entirely different. This condition fundamentally alters a person's actual sense of reality. It's a severe psychiatric disorder characterized by hallucinations, which means seeing or hearing things that aren't actually there, as well as delusions, intense paranoia, disorganized thinking, and extreme social withdrawal. It's a profound distortion of how the human brain processes the world around it.
All right, here's our fifth and final interactive check-in. Let's bring it home. Which of the following is a symptom of schizophrenia? A, hallucinations, B, fever, C, blindness, or D, hair loss? And the correct answer is A, hallucinations. Excellent work staying focused today.
Section 5. Treatment and Care, Management and Healthcare Application. Here's the truly empowering part of all this. Mental disorders can be highly managed through actionable, holistic treatment pathways, whether that's in an active hospital setting or through building daily healthy routines. Step 1 is often psychotherapy, particularly cognitive behavioral therapy, which actively helps rewire negative thought patterns. Step 2 involves medication and clinical intervention to help manage chemical imbalances. Step 3 relies heavily on robust social support systems, counseling, and peer support groups. And finally, Step 4 incorporates healthy lifestyle habits, things like regular exercise, meditation, and relaxation techniques. Getting an early diagnosis and wrapping a patient in this kind of multi-layered support drastically improves their outcomes.
As we wrap up this explainer, I want you to remember this. Understanding mental disorders helps healthcare professionals provide compassionate and effective patient care. Raising our mental health awareness reduces the stigma, and frankly, it saves lives. By understanding the complexities of human behavior, the spectrum of anxiety, the weight of depression, and the reality of schizophrenia, you now possess the tools to show genuine empathy, and empathy absolutely changes medical outcomes. So my final question to you is this. How will you carry this compassion into your daily practice the very next time you encounter a patient who is silently fighting a battle you cannot see? Thank you so much for joining me today. Keep learning and keep caring.